Hello guys, welcome to another video. In this video, we are going to cover the most important topics which are asked in the exams already, like in the MD and DNB, theory final exams. These questions or these topics were focused more for the theory examination. I have made a few list of topics in each system. So I've gone system wise this time, and I've prepared a list of few questions or topics where you need to keep your maximum focus on. And there is a high probability, like 90 to 95% strike rate, that these topics will appear in your theory final exam. So be hooked up with the video till the end. And without wasting any time, let's start with the video. So Master Anesthesia Theory Exam. So primarily, what are you expected to know? Like in your first year, second year, third year, what theoretical knowledge are you expected to gain during each year? That is more important before even you start your preparation. So during your first year, you have to know about the history of anesthesia, brief history, about different scientists or about different anesthesiologists who have contributed to the branch, contributed to the department, okay? Then anatomy and physiology of the various organ systems relevant to the practice of anesthesia. Pharmacology, the pharmacodynamics and pharmacokinetics of various drugs. Okay, the biochemistry relevant to the fluid and electrolyte balance, and also blood transfusion and blood products. Applied physics and use of equipments in anesthesia, mainly the anesthesia machine. Then you have to know the intramuscular injections, arterial and venous cannulations, and the positioning of a patient. Also the theoretical and practical background of commonly used anesthetic techniques of regional and general anesthesia, general principles of preoperative assessment and medications, introduction to operation theatre, recovery rooms and intensive care unit ICU, cardiopulmonary resuscitation and neonatal resuscitation, documentation and medico-legal aspects of anesthesia, oxygen therapy, anesthetic management of common comorbidities for ASA 1 and 2 patients like hypertension, diabetes, thyroid, asthma patients, epilepsy patients. So how the pre-anesthetic checkup for these patients should be, and how the approach should be to this patient for the anesthetic management if the patient is posted for a surgery. Okay, all these things you have to be well aware during your first year of residency. Coming on to the second year, you have to know about the introduction to research methodology, randomized clinical trials, etc., and basics of the biostatistics. Because during the second year, you will be held to select your thesis topic. So you have to make yourself more aware of the research methodology and the clinical trials. Interpretation of the blood gases and other relevant biochemical values, various function tests of various organs, and basics of measurement techniques, and electrocardiogram and chest x-ray you have to know. Okay, principles of monitoring equipment, working principles of the ventilators. You have to know about the computers. Nowadays it is all about electronic, EMR, medical recordings, and the computerized anesthesia recordings are there. You have to know how to use them. Okay, then the sterilization and disinfection of equipments, anesthetic management in special situations like ASA 3-4 patients also you have to know. You have to deal with various specialties like obstetric, gynecology, pediatric, geriatric patients, neurosurgery, cardiac surgery. You have to be aware of them. You have to know the principles of intensive care. And the aim at the end is to become competent, independent and reliable anesthesiologists to handle all kinds of elective and emergency procedures. Alright, now coming on to the third year. Now you have come to the third year, you have been teaching your juniors already. And so you have to know about the anesthesia for patients with severe cardiac, respiratory, renal, hepatobiliary disorders posted for unrelated surgery unrelated to the organ. Okay, the management of patients in shock, renal failure, critically ill patients, or patients who are already on a ventilator shifted to the OT for this surgery. Okay, you have to deal with all these patients and you have to optimize their current conditions. The chronic pain therapy and therapeutic nerve blocks, acute and chronic pain management, principles of anesthetic management for neuro, cardiac, thoracic, vascular, transplant, burns and plastic surgery. Okay, the principles of one lung ventilation, anesthesia for bariatric surgery is also very important. Okay, Now let us move on without wasting any time. The system-wise most important areas you need to focus for your theory examination. I know this is why you have opened this video and you are watching this video. So let us dive deep. Let's keep this video short yet very interesting and very important to know what topics to focus on. Now you know which system to refer to, how to segregate the topics of exam into various systems, and in each system, like which segments are most important to focus for the examination sake. Okay, now you'll know like what topics to refer to. Let's start with anatomy. In anatomy, most questions which were asked previously in already asked in MD DNB examinations, I have ruled them out. So these questions are coronary circulation, anatomy of the lung and the bronchopulmonary segments, anatomy of the upper airway, larynx and the diaphragm, respiratory muscles, okay, vertebral column and spinal cord anatomy, anatomy related to the regional anesthesia like spinal, epidural anatomy, anatomy related to the field blocks, okay, then the cerebral circulation. All these topics were frequently asked in anatomy. Not that other questions were not asked, but these questions were frequently asked and emphasized in almost every year in some or the other state university question paper. So these topics are most important. You are not allowed to miss these topics. Let's move on. Physics related to anesthesia. From physics, of course, the gas laws is the most important topics, out of which Venturi principles and Bernoulli principle and Frank-Starling law, these are very commonly asked questions. You have to know about the medical gas supply system, physics related to anesthesia machine and its safety features, fluid physics, electricity and diathermy. These are very important as concerned to physics. Okay, let's move on with physiology. You have to know about the theories of anesthesia, respiratory physiology, cardiovascular physiology, hepatobiliary, renal and endocrine system physiology. These basic physiologies you have to keep in your mind. Okay. Then the physiological changes during pregnancy. This is a very commonly asked question and you have to be thorough with every systemic changes that occurs during pregnancy. Then there is physiology of the hematological system, blood. Neuromuscular junction physiology is asked n number of times in your exam. This is a very, very, very important topic. Along with the neat label diagram, you have to write this answer. NMJ physiology. Then regulation of temperature, hypothermia, metabolism. How are you going to control hypothermia during the perioperative settings is very important. Then the cerebral blood flow, auto-regulation of cerebral blood flow is a very important question. It has been asked very frequently in the exam. CSF formation and circulation. Then you have to read about autonomic and peripheral nervous system. The ODC curve, oxygen hemoglobin dissociation curve, oxygen flux and oxygen cascade have been asked very highly and n number of times in the exam since many years. Okay, so you have to be thorough with this answer. Stress response to intubation, obesity, obstructive sleep apnea, the gradings, and the patient if he is posted for surgery, the obesity patient, how are you going to keep the positioning, how difficult is going to be the intubation, is it a physiologically difficult airway, okay, all these things you have to read about obesity, and also the management of drugs according to the ideal body weight, okay, you have to tell about all these things when you are reading about obesity. Coming on to pharmacology, you have to know about the general principles, concepts of the pharmacokinetics and pharmacodynamics, drug interactions in anesthesiology, anaphylaxis or anaphylactoid reactions, drugs used for pre-medication, induction of anesthesia, general anesthesia drugs, intravenous as well as inhalational agents. You have to be thorough. Every drug, any drug can be asked in the examination. There are no exceptions. Nitrous oxide, this is very important. There are many things in nitrous oxide which can be asked as a separate entity in the question paper. So you have to know A to Z about nitrous oxide. Uptake and distribution of inhalational agents is very important. The minimum alveolar concentration is very important. Local anesthetics, their mechanism of action, the toxicity, local anesthetic, systemic toxicity, and also what are the adjuvants which are used to mix in the local anesthetics, okay, when given with the regional techniques or also with the central neuraxial blockade. These adjuvants are also very important. Then moving on, we have muscle relaxants and reversal agents. Exclusively Sugama Dex was asked many number of times in the recent 2-3 year question papers in every university exams. Sugama Dex is a very important question. Then there are carbon dioxide absorbents. You have to know about context sensitivity, half-life, opioids and use of opioids in the central neuraxial blockade, Then dexmedetomidine, which is an alpha-2 agonist, and comparing it with clonidine is very important. Then transdermal drug delivery system, the fentanyl patch, okay, these are very important. Malignant hyperthermia, how do you manage it perioperatively? Then bone cement implantation syndrome, coming to orthopedics, is very important. Then the role of anticoagulants, perioperative, how do you manage the, if the patient is on anticoagulants or antiplatelet drugs, how are you going to manage if you are going to give central neuraxial blockade? So accordingly read the ASRA guidelines and you are expected to write them in your examination. Then levosimendan, okay, these drugs are very important. Moving on to biochemistry, you have to know about the IV fluids, crystalloids, colloids, albumin, okay. You have to know about various blood products, the fresh frozen plasma. Then you have to know about cryoprecipitate and individual factors, factor 8, 9, okay. The fluid balance and blood transfusion, perioperative fluid therapy, how are you going to do fluid therapy, what is goal-directed fluid therapy, these things are very important. You are also expected to know about the acid-base homeostasis, acidosis, metabolic alkalosis, okay. You have to know about the base excess. Moving on to history, a few scientists are listed here, you have to know about all of them, okay. Make a note of it. Equipment, you have to know each and every equipment you are using daily, how the machines are going to work, and okay, also the troubleshooting, parts, diagrams, everything you have to know. Vaporizers, capnography, pulse oximetry, these three are very frequently asked. And also invasive blood pressure monitoring, transducing, okay, neuromuscular monitoring, depth of anesthesia monitors like BIS and entropy are also frequently asked. Supraglottic airway devices, especially newer airway devices like Basca airway, okay, LMA blockbuster, these are also asked very recently. You have to know about the breathing circuits, Bain circuit, closed circuits, low flow anesthesia system, how does it work, scavenging system in anesthesia. Then the use of ultrasound, role of ultrasound perioperatively, pre-op, intra-op and post-operative, okay. Oxygen therapy devices, high flow nasal oxygen therapy, Thrive, these are very important, oxygen therapy. Then video laryngoscopes, how are they used, what are the types, okay. Then humidification, simulators in anesthesia, transesophageal echocardiography, or you know, TEG, thromboelastogram. TEG is thromboelastogram, okay. These are all bedside tests. POCUS and TEG are very, very, very important. All the bedside tests, including the bedside pulmonary function test, any question can be pop up in your examination. Then you have to know about the anesthesia machine, checklist and safety features. This is a basic thing. This is also expected during your practical examination, where there will be a separate session and a separate dedicated marks for the anesthesia machine. This question is going to be asked for you. You have to be thorough and it should be on your fingertips. All right. Now moving on to the cardiovascular system, you have to know about the cardiac output monitoring, various types, invasive and non-invasive both, and cardiac patient posted for non-cardiac surgery. It could be a coronary artery disease patient, an angio patient, or a bypass patient, or a patient with prosthetic valve or valvular heart disease. Okay, mitral stenosis patient, pregnant posted for a non-cardiac surgery. Anything can pop up in the exam. You have to be thorough with a cardiac patient, especially the preoperative evaluation is very important in these patients. Next, perioperative arrhythmias, cardioplegia, cardiac reflexes, oculocardiac reflex especially, then cardiopulmonary bypass, diastolic dysfunction was a recently asked question. Then intra-aortic balloon pump IABP, mechanism and uses, indications, aortic clamping and unclamping, patient with a pacemaker or defibrillator posted for surgery. How will you manage the patient? Okay. Moving on to obstetrics and gynecology, you have to know the pain pathway in labor, supine hypotension syndrome, Mendelssohn syndrome. These things are aortocaval syndrome. These are very commonly asked nowadays. Failed intubation drill in obstetrics, management of a ruptured ectopic pregnancy or placental abruption is very important. You have to know about the hypertensive disorders in pregnancy, especially eclampsia, preeclampsia, and HELP syndrome. You have to know how to manage these patients. Then hemorrhage, how to manage hemorrhage during pregnancy, antepartum hemorrhage, postpartum hemorrhage, massive blood transfusion. How are you going to control the bleeding in those patients? What are the methods and mechanism? You have to be thorough in all these things. Moving on to the respiratory system, you have to be thorough about the pulmonary function tests, invasive and bedside tests, spirometry, especially the functional residual capacity, and the closing capacity and closing volumes are very frequently asked in the exam. You have to know the management of the patient of chronic obstructive pulmonary disease, emphysema patient, asthma patient, exacerbation of asthma, management of all these patients. You have to be very thorough. Then moving on, we have the laparoscopic surgery. You know, the effect of pneumoperitoneum on various organ systems is very important. How are you going to do pain control in these patients? Next, laser surgery for larynx, microlaryngeal surgery. When it is a shared airway, how are things going to affect? You have to be very thorough and able to write 3 to 4 pages answer about this question. Okay. Then moving on, we have one lung ventilation, pneumonectomies, lobectomies. How are you going to manage? VATS, video assisted thoracoscopic surgeries. How are you going to manage one lung ventilation? You have to know about double lumen tubes, different types of tubes. Okay. And what are the methods when one lung ventilation fails? How are you going to recover the patient respiration? Okay. These all things we have to manage. How you will know, like how you will manage the hypoxia in these patients with one lung ventilation. This is very important. Then moving on, we have the patient with COVID-19. How are you going to manage him? Optimize him pre-operatively, intraoperatively, what you are going to expect post-operatively, and how you are going to isolate the patient and all. Okay. Then what are the types of respiratory failure? Hypoxic pulmonary vasoconstriction. Then moving on to central nervous system, you have to know about the basics like Glasgow Coma scale, raised intracranial pressure management and monitoring. ICP, nowadays they are calling it as tight brain. So in the question, if he mentions tight brain, you have to think of raised intracranial pressure management. Okay. Then myasthenia gravis, posterior cranial fossa tumor surgery. Patient is posted for craniotomy, sitting position surgery. How are you going to manage? Then we have electroconvulsive therapy, modified ECT. Okay, how you are going to give anesthesia to these patients? What are the drugs which have to be avoided? You have to know them. Then a patient is posted for kyphoscoliosis correction surgery, prone position surgery especially. So what are the things system-wise? You have to know the effects of the position on the various organ systems. Okay. Moving on to hematology and blood, massive blood transfusion, blood component therapy, blood conservation strategies. These are the 3 questions which are very constantly being asked, and you have to be thorough about these 3 topics. Then you have to know about crystalloids, colloids, fluids, albumin, the effect of fat embolism and air embolism after long bone fractures of lower limb fractures. How are you going to manage these? How are you going to diagnose and manage these conditions? This is what you are expected in the exam. Next, you have to know about management of a patient with sickle cell anemia or hemophilia posted for surgery. It could be a disease or a trait. So how are you going to manage? Then what are the precautions to be taken while handling HIV or hepatitis B patients? This question is also being asked recently. Moving on to general anesthesia, I have put some general topics, miscellaneous topics, and also topics which are very prevalent to general anesthesia in this, in this category. So moving on, we have awareness under anesthesia and depth of anesthesia monitoring. Okay, this is very important question asked since ages in every exam. Next, TIVA, total intravenous anesthesia, PCA pumps and all. Physiological changes during positive pressure ventilation. Fasting guidelines for both adults, children, infants, everybody. Then airway assessment, especially Mallampati grading and Cormack-Lehane grading. Okay, what are the steps and components of general anesthesia? Delayed recovery, what are the causes and how do you manage? Both things you have to be thorough. Rapid sequence induction and intubation. Hypotensive anesthesia, what BP measures are you going to take? What are the drugs you will use and what are the indications to give hypotensive anesthesia and what are the complications which are expected? These things you have to know about this question. Now moving on, you have to know about the pre-anesthetic checkup. Yes, pre-anesthetic checkup also came as an exam in quite a few times in every exam. Then there is a question called medical legal aspects of anesthesia, ethical aspects, discharge criteria from PACU, various discharge criteria are available, Aldred score example. Then you have to know about 3 conditions for post-operative shivering, post-operative nausea, vomiting, post-operative delirium and cognitive dysfunction. If you are more eager, you should also read post-operative blindness. That was also asked quite a few times. So shivering, nausea, vomiting, delirium or cognitive dysfunction, post-operative blindness. These 4 answers are very important during the post-operative period. Next, effects of smoking, Okay, smoking cessation, how is it going to go through the course? All that you have to know. Then the positional hazards, like we discussed before, sitting position, supine position, prone position, lateral position, lithotomy position. So what are the changes, physiological changes, and various organ systems, how are they going to be affected with different positions? You are expected to know all this. Next, you have to know about the bronchospasm, laryngospasm, how are you going to differentiate them, diagnose them, and also treat them. Non-operating room anesthesia, especially MRI, patient posted for MRI or child posted for MRI. This is very important. Then you have the daycare surgery, disinfection and sterilization, ERAS protocols, enhanced recovery after surgery protocols, anaphylaxis, burn contracture patient. Like if he has a burn contracture, already known case of burns, is a contracture neck. How are you going to intubate that patient, awake, fiber optic intubation and all? So these things you have to be thorough with. Then you have to know about the disaster management. Nowadays, artificial intelligence, electronic medical records, closed loop anesthesia delivery system, computers used in anesthesia. These questions are being asked in the fourth paper for recent advances. So you have to know at least 10 points about each question. Okay. Coming to central neuroaxial blockade, you are expected to know about the epidural anatomy and space detection of epidural, fate of the drug after epidural injection if the epidural does not function. Then caudal anesthesia, spinal anesthesia, you have to know A to Z about spinal anesthesia, no exceptions. You have to know about the needles used for spinal anesthesia also. And most importantly, you have to know about PDPH, post-dural puncture headache. How are you going to diagnose? And also how are you going to treat the patient with PDPH? Okay, definition is very important. Moving on, you also have recently advanced segmental spinal anesthesia. This question is being asked quite a few times. Moving on to gastrointestinal system or liver, you have to know about the liver function test, portal circulation, cirrhosis, a chronic liver disease patient, child B, C, posted for surgery, and how are you going to manage the patient, what are the investigations you are going to ask. Exploratory laparotomy for subacute intestinal obstruction or perforation. Okay, how are you going to manage the fluid management in this patient? How are you going to replace the third space losses? Post-operative ventilator management, all this is very important, and especially the pain management in these patients is expected from you. Then hepatorenal syndrome types is very important. Moving on, we have critical care topics like serum electrolyte abnormalities. Sedation in ICU is a very, very, very important topic. You have to know it. And Richmond agitation sedation scale is very important. You have to know about PEEP, auto PEEP. What are the types of NIV? What is the differentiation between CPAP and BiPAP, and when is it used? You have to know about acid-base abnormalities, base excess, acute respiratory distress syndrome, ARDS. What are the ventilatory management strategies? What is low tidal volume ventilation, lung protection strategies in ARDS patients is expected. Next, you have poisonings, especially organophosphate poisoning is very important question, asked very, very, very it's very important. Many number of times it was asked in the exam. And next, barbiturate poisoning, benzodiazepine poisoning. These were also asked. So sodium nitroprusside and all. Okay. Weaning criteria, cardioversion and defibrillation. What are the differences? POCUS, point of care ultrasound. Lung ultrasound is very important. Gastric ultrasound, airway ultrasound, and also EFAST. Okay, focused assessed sonography is also very important. Then all types of shock and management. You have to know about the recent sepsis guidelines, central venous cannulation and CVC bundles, pulmonary edema, DVT prevention, thromboprophylaxis, how you are going to do, invasive, non-invasive, medical. Okay, newer modes of ventilation, ventilator associated pneumonia, next cardiopulmonary resuscitation, the basic BLS, ACLS guidelines. How are they applicable to adult, child and pregnant? You have to know the flowcharts of all these guidelines. You have to keep in your mind before going to the exam. Next, extracorporeal membrane oxygenation, ECMO is important. Then you have to know about heparin-induced thrombocytopenia and how are you going to reverse the heparin toxicity and all, overdose. Then you have to know about brain death criteria. Next, nutrition in ICU is very important. TPN, you have to know how are you going to calculate the doses according to the weight of the patient. Then tracheostomy, percutaneous tracheostomy, invasive tracheostomy, surgical tracheostomy. What are the differences? How are you going to give anesthesia for the surgical tracheostomy and all? Moving on to peripheral nerve blocks, you have to know about all the blocks which are listed in this slide, like the abdominal wall blocks, airway blocks, scalp block, especially the brachial plexus block. Different approaches, all the approaches have been asked in the exam. You have to be thorough about it. Then celiac plexus block, stellate ganglion block, intercostal nerve block for the rib fractures, or the ICD drain is very important. Adductor canal blocks or femoral blocks, for the TKR patients and lower limb surgery patients is important. Ocular blocks you are expected to know. Peng block, IPAC, PEX, erector spinae, paravertebral, these are being asked recently in the exams. So you have to know all them. Then coming to kidney and endocrine function, renal function tests you have to know. Basic, not asked many times, but have an idea of the various kidney function tests. CKD patient management, renal transplant is very, very, very important. You have to be thorough with this answer. Preoperative, intra and postoperative management of renal transplant, kidney transplant, okay? Renal replacement therapy, transurethral resection of prostate, TURP or TURBT management, pheochromocytoma, robotic surgery, thyroid storm or thyroidectomy, diabetic ketoacidosis patient or diabetic autonomic neuropathy patients posted for surgery. Next, if you have pediatric patients, fetal circulation and transition to neonatal circulation. This answer was asked many times. Next, tracheoesophageal fistula management, perforated eye injury in a child, congenital diaphragmatic hernia management, cleft lip, cleft palate is also very, very important question. This is also a short case for your practical examination. Then tetraloophalate patient posted for surgery, adenotonsillectomy and post-tonsillectomy bleeding is a very important question. Then a foreign body in the bronchus, removal by ENT surgeons. So how are they going to do and what kind of anesthesia you are going to give, what is jet ventilation and all, you have to be thorough. Coming to pain medicine, pain pathway and theories of pain, modalities of acute and chronic pain relief, patient controlled analgesia, preemptive analgesia, CATS pump, all these are very important. And also you have to know different methods of pain assessment in adults, children and also infants. Next answer is complex regional pain syndrome and what are the types of it, how you manage this condition. And the last topic is statistics. In statistics, not many questions were asked in the MD examination, but in the DNB, quite a few questions are asked every year. And the most important ones are randomization, sample size calculation, statistical tests, forest plot, and types of general articles. So all these things you have to know. Also, bias, how does bias function in the statistics? That is also very important. You are expected to know. And this is my Instagram page, Anesthesia Notes. Do follow us on Instagram if you're not following already. And also I'll put a Telegram link below for a Telegram group where I am posting MCQs every day. You can follow the Telegram group and answer a few MCQs each and every day. So the disclaimer or the note is that I have prepared this list of essential topics for your exams. While these topics are not guaranteed to appear, but they are very crucial for any student preparing for the exam. You are must and expected to know all these topics very thoroughly. And I'm very sure you are going to pass your exam with flying colors if you are good with all these topics. Okay. Now I wish best of luck with your exams and thank you for listening patiently till the end. And if you want me to make a similar video about the practical viva also, do comment in the comment section below and let me know and I'll get that video also to you. Okay. Thank you. If I have missed any important question or important topic, you can definitely comment in the comment section so that it will be helpful for other students who are watching this video. Okay. Alright guys, thank you, all the best.